those that are ready to get vaccinated get in front of the line and make an appointment.
As Connecticut's vaccine rollout gets set to expand over the next few weeks, healthcare providers say they are ready to move things along.
Cities and towns are preparing to meet a big demand for shots. Channel 3 New Haven Bureau Chief Matt McFarland is live outside the New Haven Health Department with more on the preparations there. Matt.
Hi there, Aaron and Mark. Well, you know, every adult in Connecticut is going to have the opportunity to schedule for a vaccine by early April. So we know there's going to be a lot of eligible folks pretty shortly, just in the next few weeks. So providers like the New Haven Health Department, well, they're already making plans.
When we start this Friday taking appointments for 45 and plus, we will then assess. And then by April 1st, we'll be weeks in. And so I think the timeline is perfect.
And in order to keep up with that potential demand as eligibility for the COVID vaccine expands, New Haven Health Director Maritza Bond says they're already looking into a number of different models to help get more shots into more arms.
One of them is looking at our infrastructure with the possibility of EMS, partnering with the American Red Cross.
Yesterday, Governor Ned Lamont announced Connecticut would be accelerating its rollout as the state expects to soon start receiving 200,000 doses a week. Yale New Haven Health, which has a number of mass vaccination sites around the state, including one in New Haven at the Floyd Little Athletic Center, will also be ramping up. In fact, back in late January, Yale told us it was all ready to go.
We have the staff, we have the technology, we have the pharmacists, we have the nurses. What we need is vaccine.
Under the plan, those 45 to 54 can start scheduling appointments on Friday. Those 16 to 44 will now be lumped together in one group, with scheduling starting on April 5th. The state says a portion of that younger grouping has already been vaccinated due to jobs as healthcare workers or teachers, and adds data shows younger folks might not rush out to get the vaccine like we've seen with previous age groups. But Bond says the new timeline is key because here in New Haven, nearly all of the new COVID positive cases they're now seeing are connected to younger people.
My data is telling me that most of those impacted by COVID have been 25 to 49-year-olds in these specific neighborhoods. We need to get to the shot in the arms of those that are younger.
Now, it's not just ramping up to make sure they have the capacity to get those vaccines out. The City of New Haven, the Health Department, they're also doing outreach as well to let folks know they are going to have a number of options if, in fact, they do want that vaccine. We're going to have that part of the story coming up tonight at 6. We're live with the mobile newsroom in New Haven. Matt McFarland, Channel 3 Eyewitness News.